Have you been offered a hormone therapy like birth control, Orilissa, Visanne, or Lupron for your endometriosis symptoms? Welcome back to the Endo Fertility Space channel. In this video, I'm breaking down what are the available medical management options for endometriosis, the method of action for these medications, possible side effects, and things to consider when taking these hormone therapies. If you haven't already, please like, share, and subscribe for the best endometriosis content here on YouTube. Before I go into breaking down the available options and what the research tells us about these options, it's important to understand what these therapies are designed to target. Endometriosis implants or lesions lead to an increased production of estrogen, pro-inflammatory chemicals, also known as cytokines, prostaglandins, which are inflammatory hormone-like compounds that can be inflammatory or anti-inflammatory, matrix metalloproteinases, which contribute to endoproliferation and spread, and they contribute to a failure of the immune cell response to suppress and clear the inflammatory action that occurs in response to endometriosis lesions. Estrogen is crucial for the growth and persistence of endometriotic implants, and endo lesions have more aromatase activity, which leads to more conversion of estrogen from androgens like testosterone. The uterine lining in people with endo is rich in estradiol receptors, which when bound leads to more aromatase activity. Additionally, ovarian and adipose estrogen production can also reach sites of endometriosis lesions. So that means if we're carrying a little bit more fatty tissue is a known source of estrogen production, and that estrogen produced by that fatty tissue can also reach sites of endometriosis lesions and contribute to their growth and proliferation. Hormone therapies target these lesions and reduce estrogen production to varying degrees. Some are better than others at also reducing inflammation or action of pro-inflammatory chemicals and or those metalloproteinases I mentioned previously that contribute to the growth and spread of these lesions. So what are the available medical management options for endometriosis, and what does the research say about how effective they are? Hormone therapies include different types of medications like combination birth control pills, which contain both some form of synthetic estrogen and progestin. There are progestin-only medications, aromatase inhibitors, danazol, and gonadotropin-releasing hormone analogs. Let's break these down. The combination of synthetic estrogen and progesterone in a combo birth control pill blocks ovulation by suppressing FSH, which is follicle-stimulating hormone, and LH, which is luteinizing hormone, release from the pituitary in the brain. If taken continuously, combo birth control pills reduce the uptick in inflammatory chemicals called prostaglandins that cause the uterine contractions responsible for the shedding of the uterine lining at menstruation. Prostaglandins also contribute to the pain associated with menstruation. Endometriosis is in part an estrogen-dependent condition. The blocking of estrogen and lowering of inflammatory prostaglandins absolutely can reduce pain symptoms related to endometriosis or that stem from endometriosis. In fact, this randomized control trial, including 100 participants, showed that painful periods were reduced in the endometriosis group and were reported to be milder than in the placebo group. Endometrioma size was also observed to reduce in the oral contraceptive pill group, but not in the placebo group. Another study showed that comparatively to gonadotropin-releasing hormone analogs, oral contraceptive pills were less effective after 6 months of use, although both were reported to reduce symptoms after 12 months of use. In this systematic review, combined oral contraceptives and progestin-only pills were associated with a significant reduction in non-cyclical pelvic pain and pain with intercourse. Ethinyl estradiol norethindrone acetate and ethinyl estradiol androspirenone showed better results for pain. And just as a side note, these are different forms of synthetic estrogen and progesterone combinations. So something to note, not all birth control pills are made the same. Some contain interesting ingredients that you should be aware of if you are iron sensitive, lactose intolerant, or sucralose sensitive. Check out this list of some common birth control pills and the sneaky ingredients you may find inside them. This is especially important to consider if you start experiencing changes in your digestive symptoms or pain levels when you start a new combo pill. While we don't have a ton of research on this topic, and the one study we do have is not showing a causal link necessarily, a history with oral contraceptive pills for severe period-related pain was associated with surgical diagnosis of endometriosis, especially deep infiltrating endometriosis. Let's talk a little bit about the progesterone-only pill or progestin-only pill. sometimes also called the mini pill. It works similarly to the combination birth control. It just doesn't contain synthetic estrogen. Norethindrone, Dynagest or Visanne, Dabrowska, gestrinone, medroxyprogesterone acetate, and mengestrol acetate are examples of progestin-only medications. Progesterone-only pills also block estrogen-induced cell replication, so cells that are replicating when stimulated by estrogen, it blocks that. They alter estrogen receptors and block the blood supply to endolesions. They also block the expression of certain proteins involved in endometriosis progression. Because these medications expose the uterine lining to estrogen but not progesterone, it's common to experience abnormal bleeding or spotting while using these medications. Progestins also come in different forms. Medroxyprogesterone and dydrosterone are more structurally similar to natural progesterone. I mean, the structures are not identical, but they're structurally more similar to natural progesterone. Levonorgestrel, norethindrone, and drospirenone, however, are more structurally similar to testosterone. This means that androgen excess symptoms can intensify in androgen-sensitive individuals when using these particular forms of progestin. So if you're already experiencing a lot of oily skin, acne, hair growth in undesirable places like on the face, chest, or back, if you're feeling your dominant emotion is aggression, you might consider opting for a progestin-only pill or a combo pill that has one of those forms that's more structurally similar to progesterone. Studies using varying doses of medroxyprogesterone from 10 to 100 milligrams per day for 3 to 6 months have reported varying degrees of improvement in endo-related pain. One advantage of an injectable progestin, because they also come in injectable form, is better compliance by avoiding daily administration and erratic gastrointestinal absorption. That's right, your absorption of these meds can vary and their effectiveness can be influenced by loose stools or vomiting. Oral Provera or depot injections are other forms of progestin-only medications. One study comparing depot to Lupron showed that both are comparable in their efficacy for improving pain with menstruation, pelvic pain, pain with intercourse, pelvic tenderness, and pelvic induration, which is the thickening or hardening of soft tissue in the body. Depot was shown to result in less bone loss comparatively to Lupron. Depot was also shown to result in fewer low estrogen symptoms, but more irregular bleeding, which is typical with progestin-only meds. Contrary to this study, a second study showed that Depot resulted in more total hip and lumbar spine bone mineral density loss than Lupron. Norethindrone acetate has been shown to be effective for pain with intercourse, pain with menstruation, pelvic pain, and pain with passing stools. In general, it's better tolerated and has fewer side effects in lower doses. A study using norethindrone acetate at a dose of 2.5 milligrams per day for 12 months achieved similar pain control when compared to combined oral contraceptives and cyproterone acetate, and suggested that it could be a good alternative to oral contraceptive pills. Dynagest or Visanne has high specificity for progesterone receptors and has fewer anti-androgenic side effects. It also has anti-inflammatory, anti-angiogenic, so again, that is a reduction of the blood supply to endometriosis lesions, and anti-proliferative effects. Let's talk a little bit about the IUD. So the IUD is another form of hormone therapy used to manage endo symptoms, unless you're using a copper IUD, which would be non-hormonal. Research shows that a Mirena IUD combined with gonadotropin-releasing hormone analogs was effective at reducing pain with intercourse and resulted in lower levels of estradiol, follicle-stimulating hormone, luteinizing hormone, and CA125 versus those who were treated with a gonadotropin-releasing hormone analog only. CA125 is a sensitive marker of inflammation that tends to elevate predominantly in various types of gynecological cancers, but it can also elevate in response to deep infiltrating endo and large endometriomas. So this is a nice marker to see decrease with the use of hormone therapies. Other small studies have hypothesized a connection between IUD use and the development of endometriosis. In a review of 4 randomized controlled trials, no studies reported outcomes of overall pain. The results were unclear regarding whether the IUD improved pain with menstruation after 12 months of use. It was unclear also if the IUD improved quality of life after 12 months of use. One study did show improvements in quality of life after surgery with the insertion of an IUD. Post-operative melasma and bloating were reported in one study following the insertion of an IUD post-surgically. Other studies propose a connection between mast cell reduction via the Mirena IUD placement, suggesting a connection between pain, mast cells, and endometriosis. Higher estrogen triggers mast cells to release histamine, and histamine can act on smooth muscle, contributing to cramping, pain, or even softer stools. This study showed that the majority of unsatisfied IUD users removed the IUD in under 12 months due to irregular and intolerable bleeding and persistent pain. This is an unfortunate common side effect with any type of progestin-only medication because it does expose the uterine lining to estrogen but not progesterone. Weight gain and one-sided abdominal pain were also symptoms reported by IUD users. For those who tolerated the IUD after 12 months, it was shown to improve pain for up to and after 36 months. The successful use of gonadotropin-releasing hormone agonists is based on the profound low estrogen state that occurs due to the ovarian suppression of estrogen production. Studies have shown that gonadotropin-releasing hormone agonists cause significant reduction in pelvic pain in women with endometriosis. However, they are approved for continuous use for only up to 6 months due to concerns of side effects secondary to a very low estrogen state like bone loss, vaginal atrophy and dryness, hot flashes, and abnormalities in the lipid profile. I do believe that this has changed from the time that this study was published, but there are still reasonable concerns over the long-term or short-term effects of a severe low estrogen state. Medications like cetrorelix, a gonadotropin-releasing hormone antagonist, was also shown to provide symptomatic relief and changes in endo lesions visualized on laparoscopy. These medications induce a lower degree of a low estrogen state and are generally better tolerated than gonadotropin-releasing hormone agonists. Let's talk a little bit about danazol. So danazol is a synthetic steroid and shares structural similarities with testosterone. Danazol blocks production of sex hormones from cholesterol in the ovaries and adrenals. Danazol is indicated for use in endometriosis patients at doses ranging from 100 milligrams to 400 milligrams. Danazol is reported in the research to be effective for relieving painful symptoms related to endometriosis, but one of the largest barriers to use is the long list of androgenic symptoms, including acne, hair growth in undesirable places, hair loss from the head, and oily skin. Let's talk a little bit about aromatase inhibitors. So aromatase inhibitors work by blocking the increased expression of the aromatase enzyme in endometriosis patients, which leads to more estrogen production. Aromatase inhibitors like letrozole do not block ovarian hormone production. So the literature we do have shows letrozole being used alongside additional agents that block ovarian hormone production. The combination of letrozole with norethindrone acetate for 6 months showed no recurrence of endometriosis via laparoscopy. Pelvic pain scores were also reported to decrease, and no changes were observed in bone mineral density. Another study showed similar results, but with pain recurrence after treatment was stopped. In a small study, 1 milligram of anastrozole with 200 milligrams of oral progesterone showed a rapid and progressive decrease in symptoms over 3 months. Symptoms remained in remission for greater than 2 years after treatment. Several other studies using a combo of letrozole with oral contraceptive pills and gonadotropin-releasing hormone agonists showed varying degrees of symptom resolution. You can find more on these studies in this review. One very unique finding when it comes to aromatase inhibitors like letrozole is that it has excellent application for postmenopausal endometriosis. Because aromatase inhibitors can block estrogen production from outside the ovaries, they have been remarkably effective for women with endo symptoms in this stage of life. The primary source of estrogen in the postmenopausal stage of life is adipose tissue. You also get some estrogen production from the adrenals. So certainly letrozole would have a lot of application in this stage of life. Aromatase inhibitors coupled with progestin use also showed promise in reducing endometrioma size. This study showed that 5 milligrams per day of letrozole with add-back norethindrone acetate or combo estrogen to progestin hormone therapy resulted in a 50% reduction in endometrioma size. To summarize this section of the video, if you are considering a hormone therapy, firstly consider the form of estrogen and progestin. If you're considering a combined oral contraceptive pill, ethinyl estradiol and norethindrone acetate and ethinyl estradiol and drospirenone appear to be the most effective based on the research. However, drospirenone is more structurally similar to testosterone, so consider if you're already experiencing androgen excess symptoms like the oily skin, acne, hair growth, and undesirable places that we talked about. And if you are, maybe talk to your doctor about a form that's more structurally similar to progesterone. Consider also how likely you are to comply with taking your medication. Injectables or an insertable IUD may be a better option for you if taking a daily pill will be a difficult task for you. Gonadotropin releasing hormone antagonists like cetrorelix may be a better option for you if you're being recommended a medication that creates a low estrogen state, but you want to mitigate bone loss, vaginal wall atrophy, and or mood shifts that are consistent with a severely low estrogen state. Consider underlying symptoms that might make you more prone to symptoms from hormone therapy. For example, if you already experience high androgen symptoms, maybe consider the medroxyprogesterone or dydrosterone form of progestin if considering a progesterone-only pill or a combo birth control pill. Also consider if you're already experiencing low mood, anxiety, sleep concerns, you might want to stay away from a progestin-only pill or a gonadotropin-releasing hormone analog medication. In general, when asked, I encourage fellow endo sufferers to explore the IUD and or a progestin-only medication if hormone therapy is the avenue you want to explore. In general, these treatment options have fewer physiological side effects. In the case of the Mirena, 80% of women will start cycling regularly after 1 to 2 years post-insertion, which I appreciate as it allows for the production of anti-inflammatory, anti-proliferative, mood-boosting, and anxiety-reducing progesterone. Progestin-only medications can contribute to elevated blood sugars, but the effects on cholesterol are positive. Progestin-only meds actually increase HDL, which is the good type of cholesterol, and lower LDL. Progestin-only meds also don't appear to have the same negative effect on thyroid function as other forms of hormone therapy. Progestin-only meds, however, and the IUD will still affect digestive health markers and liver health negatively. So speaking of the physiological effects of these hormone therapies, let's dig into this next. You've probably heard this before, but oral contraceptives are known to deplete several important vitamins and minerals, including folate, B6, riboflavin, vitamin A, iron, copper, magnesium, zinc, B12, and calcium. Approach caffeine intake with caution as well, especially if you are already sensitive to caffeine or already dealing with difficulty sleeping or with heightened anxiety, as oral contraceptive pills increase caffeine levels by 30 to 40%. Now, when it comes to these nutrient deficiencies that the birth control pill can cause, there are a lot of implications for if and when you decide to transition off the pill, or even if you stay on the pill long term. B vitamins are extremely important for energy production from the foods that we're consuming. They're also essential for eliminating estrogen through the liver. If the oral contraceptive pill creates an iron deficiency, iron is one of those things that's like Goldilocks and the Three Bears. You want to have just the right amount. If you're deficient in iron or if you have an excess of iron, both of those two states can drive quite a bit of inflammation in your body. Magnesium is also really important for various enzymatic reactions in the body. It's really important for maintaining a healthy stress response, for eliminating estrogen, for promoting good sleep and a healthy, stable mood. So that's another one that has some pretty significant implications when it's deficient. Vitamin A, specifically the active form of vitamin A, is really important for egg quality and fertility. It's also really important for your immune response. Zinc deficiency has been linked with endometrioma development. It's also implicated in how we convert thyroid hormone. So it's really, really, really important that you mitigate any nutrient deficiencies that may come from long-term use of birth control. The following symptoms are reported in over 5% of participants compared to controls. These include appetite changes, swelling, depression, high blood pressure, and elevated insulin. Nausea and vomiting are reported in over 20% of participants compared to controls in the research. Just as a side note, this is the resource that I'm using to share all the information about symptoms for some of these major classes of medications. This is a resource that was shared with me when I was doing my dietetic internship. The little pamphlet insert on any prescription medication that you might get, this is the resource that information would come from. So it's all the pooled research on the side effects for that particular medication. So I'm not linking to the studies in the video, but this is the resource where it's coming from. Oral contraceptive pills can also negatively affect liver function, cause migraines, high blood pressure, and swelling. Several different types of birth control pills also have certain concerns. Yaz, for example, contains drospirenone, which can cause a decrease in blood pressure, liver concerns, which in very rare cases includes liver tumors, and gallbladder disease. Monitor the following labs when on hormonal birth control: glucose, insulin, folate, albumin, iron, alkaline phosphatase, bilirubin, GGT, AST, ALT, which are your liver enzymes, LDL, HDL, cholesterol, triglycerides, and your thyroid function. Birth control can also contribute to leaky gut, so definitely consult with a practitioner you trust if you start experiencing sticky stools, swelling, food sensitivities, hives, rashes, congestion, or other similar symptoms. So we've mapped out what are some of the commonly reported side effects. So what can you do? What's within your control if you feel like you've tried everything and it's time for you to pursue a hormone therapy? This is what is within your control to help mitigate any of these side effects. Because oral contraceptive pills affect digestive health markers, one easy daily intervention to focus on is eating well-structured meals that contain protein, fat, and fiber spaced 3.5 to 4 hours apart. An amazing way to also support hormone elimination is by maintaining a 14 to 16 hour gap between the last time you're eating for the day and then your first meal the next morning. Consider eating lots of liver-loving foods, often like dark leafy greens, cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, cabbage, radishes. Consume flax seeds, broccoli sprouts, and dietary phytoestrogens often, or make regular use of a sauna or castor oil pack over the liver to support your liver function. Consider also adding some blood sugar supporting supplements to your routine like magnesium or chromium. A good quality multivitamin is another supplement to consider to mitigate any nutrient deficiencies that come with being on the pill long term. Prioritize nutrient dense foods often like organ meats, seafood, dark leafy greens, dark chocolate, and eggs. Exercise regularly to support healthy cholesterol levels, and if your levels do start to creep up, consider 1.1 to 1.2 grams of plant sterols per day. Before making the decision to pursue a combo birth control pill, consider also the forms of progestins and compare against your current symptom picture. Like I mentioned previously, not all pills are made the same. Many have forms of progestins more similar to testosterone, which may exacerbate symptoms if your androgens are already high. Also, consider any sneaky ingredients you may be sensitive to, like lactose, and have your iron tested to know whether you need to avoid pills with iron or not. Iron oxidizes quickly and it can add to your overall inflammatory load if you take a pill with iron and don't actually need it. Iron is also notorious for causing constipation, so if you start a pill with iron in it and notice this change in your digestion, consider increasing the amount of fiber in your diet. Try BioGaia, which is the Lactobacillus reuteri probiotic strain that's specific for constipation. Ginger can be helpful for moving the bowels, and magnesium citrate draws water into the bowels to help with producing that bowel movement. The following symptoms are reported in the research for Orilissa and other gonadotropin-releasing hormone analogs: mood changes, bone loss, hot flashes, night sweats, headaches, nausea, and vaginitis. With gonadotropin-releasing hormone analogs, testosterone and estrogen will aggressively decline in the blood, so any symptoms consistent with chemical menopause are fair game on these medications. Gonadotropin-releasing hormone agonists elevated liver enzymes by 3 times the normal limits in the research, so you're really going to want to focus on some liver-loving interventions. Lupron depot also contains mannitol, so keep this in mind if you have a sensitivity to sugar alcohols. The following symptoms are reported in over 5% of participants compared to controls when it comes to the use of gonadotropin-releasing hormone analogs. These symptoms include undereating, increase or decrease in weight, constipation, swelling, dizziness, bone or joint pain, breast pain, physical weakness or a lack of energy, difficulty sleeping, pain with urinating or passing urine, and increased thirst. The following symptoms are reported in over 20% of participants compared to controls when using these medications, and they include nausea and vomiting, hot flashes, reduced bone mineral density, headaches, vaginitis, which is inflammation of the vagina, amenorrhea, which is missed periods. Other reported symptoms include heart palpitations, mood swings, blurred vision, peripheral neuropathy, which is numbness or tingling in the extremities, acne, hair loss or hair growth in undesirable places as well. Monitor the following labs when taking a gonadotropin-releasing hormone analog like Lupron or Orilissa: iron, white blood cell count, AST, LDH, which is lactate dehydrogenase, alkaline phosphatase, calcium triglycerides, cholesterol, LDL, HDL cholesterol, glucose, and uric acid. So what can you do if you're taking one of these medications? What's within your control? Because these medications, especially Lupron, affect digestive health markers, the same interventions as I previously mentioned with the oral contraceptive pill apply here. For supporting immune function, you can consider complementing your diet with more zinc, andrographis, elderberry, cordyceps, or turkey tail. Getting good sleep, maintaining healthy blood sugar balance, and exercising are essential for immune health. Consider eating lots of liver-loving foods. Again, think things like dark leafy greens, cruciferous veggies, flax seeds, broccoli sprouts, and dietary phytoestrogens like organic tofu, tempeh, edamame, if these are well suited to you and you tolerate them well. Or again, consider making regular use of a sauna or castor oil pack over the liver. Lemon water in the morning or bitter teas like dandelion or ginger tea or peppermint tea can also be helpful for supporting bile flow from the liver. Consider vitamin D, K, and calcium supplementation. My favorite whole food supplements for calcium are the Moon Juice Pearl Powder or the Crucial 4 Pearl Powder. Your calcium needs for the day are 1,000 milligrams. 1 teaspoon of the Crucial 4 Pearl Powder gives you 950 milligrams. You can of course get these from dietary sources as well, but you want to be extra on top of maintaining good bone health when taking these medications. Eat iron-rich foods often as well. These include things like organ meats, legumes, lentils, dark chocolate, dried fruits, oysters, lamb, beef, clams, eggs, pumpkin seeds, and sardines. Exercise regularly on these meds to support healthy cholesterol levels, and if your levels do start to creep up, you can again consider that 1.1 to 2.2 grams of plant sterols per day. I'm going to link to the Endo diet score below, which is a great general guide to follow for eating an anti-inflammatory blood sugar stabilizing diet as somebody with endometriosis. When it comes to exercise, I would prioritize primarily resistance training, as resistance training can help strengthen the bone. If you have a history with vaginal infections or a thin vaginal wall, consult with your doctor about other options or maybe complementary estrogen vaginal cream. If you already experience low mood, anxiety, depression, have a history with osteopenia or weak bones, have a history with elevated liver enzymes, if you know you've been exposed to mold or you regularly consume alcohol, or if you're regularly using high-dose anti-inflammatory medications, consider another option. One of the advantages of Visanne or other progestin-only medications is that they spare bone mineral loss. This is also one of the most promising medications for reducing invasiveness of endo implants, and it has measurable anti-inflammatory effects. In general, when it comes to progestin medications, they come in many different forms, like we've already discussed, so be sure to do a comprehensive audit of your symptoms to determine whether a form more structurally similar to testosterone or more structurally similar to progesterone would be better suited to you. Visanne and other progestin-only medications reduce blood insulin, which could lead to higher blood sugars. These meds also lower LDL and raise HDL, which is actually quite beneficial and anti-inflammatory. They do lower T3 hormone uptake and elevate liver enzymes. So a lot of the strategies we talked about for supporting the liver will apply here as well. Having high blood sugars or uncontrolled blood sugars is going to introduce a massive amount of inflammation in the body. Blood sugar dysregulation when taking these medications can lead to abnormal amounts of testosterone and estrogen if and when you decide to come off the medication, which can drive more aggressive symptoms. Blood sugar dysregulation also leads to more production of something called advanced glycation end products, which will also increase the overall inflammatory load on the body. So it is really important that because there is that link between reduced blood insulin and higher blood sugars when taking these medications, that you do your very best to maintain a healthy, well-structured diet, meals that contain protein, fat, and fiber and are well-spaced. You can also consider a blood sugar supportive supplement like magnesium and or chromium. So to support your body on these medications, you want to exercise and eat a blood sugar stabilizing diet, including protein, fat, and fiber with every meal. Consider blood sugar stabilizing supplements as well, like magnesium or chromium. Eat liver-loving foods often, like dark leafy greens, cruciferous vegetables, flax seeds, broccoli, and dietary phytoestrogens, or make regular use of a sauna or castor oil packs over the liver. I've mentioned this already a few times, but bitter teas, lemon water in the morning, are also great options for supporting the liver. Have your cholesterol levels, blood sugars, liver enzymes, and thyroid hormones monitored regularly on these medications. Similarly to gonadotropin-releasing hormone analogs, approach these options with caution if you already have concerns over low mood, depression, anxiety, or issues sleeping. If you already experience abnormal bleeding or spotting, this can definitely persist or worsen while on progestin-only medications, so this is something to consider. You can also consider the ProBio Mood Pure Encapsulations probiotic to support mood and be sure to get out often and exercise for natural mood boosting benefits of these interventions. Depending on the type of the IUD, a lot of the same interventions I've already discussed will apply. Some universal contraindications include an infection or inflammation at the time of insertion, vaginitis, uterine abnormalities, pelvic inflammatory disease, a history with pelvic inflammatory disease, history with postpartum endometritis within the last 3 months, abnormal uterine bleeding of unknown origin, sensitivity to any component of the IUD, liver tumors, liver disease, Wilson's disease, sensitivity to copper in the case of a copper IUD, and conditions that increase the risk of pelvic infection. I hope this video was insightful, and I hope I've supported or helped you in some capacity to make a decision about whether to pursue hormone therapy for endometriosis symptom management and what to consider. Please drop any questions in the comments below. Don't forget to like, share, and subscribe if you haven't already, and I'll see you in the next video.